Contrary to popular belief, men aged 60 and above are not necessarily disinterested in sex. The notion that erectile dysfunction or impotence is inevitable at this age is inaccurate. Men over 60 can still have children and, in many cases, enjoy a fulfilling sex life. This video explores this topic further, offering insights that can benefit both men and their partners. Even if your fathers or grandfathers aren't comfortable watching it, encourage your wives to share the information with them. A healthy sex life can contribute to better overall health and longevity. Remember, sex is good for your health and can extend your life. Watching this video is crucial because it highlights the significant benefits of sexual activity for men aged 60 and above. Let's explore these advantages in detail. Improved cardiovascular health. Sexual activity, like any moderate exercise, improves cardiovascular health by increasing blood flow and strengthening the heart. This is particularly beneficial for older men who may be at higher risk of heart disease. Enhanced mood and mental well-being. Sex releases endorphins, natural mood boosters that reduce stress, anxiety, and depression. Maintaining an active sex life can contribute significantly to a positive mental outlook, which is crucial for overall well-being in later life. Increased testosterone levels. While testosterone levels naturally decline with age, regular sexual activity can help maintain healthier levels. This hormone plays a vital role in maintaining muscle mass, bone density, and energy levels. Stronger intimacy and bond. Sexual intimacy strengthens the emotional bond between partners, fostering a sense of connection and companionship that is essential for a fulfilling relationship. This is particularly important in later life, when social circles may shrink. Improved sleep quality. The release of endorphins during sexual activity can promote relaxation and improve sleep quality. This is beneficial for older adults who often experience sleep disturbances. Increased self-esteem. Maintaining a fulfilling sex life can boost self-esteem and confidence, contributing to a more positive self-image. Regarding the capacity for multiple rounds of sexual activity, while individual capabilities vary, it's inaccurate to assume that men over 60 are incapable of multiple rounds of intercourse. Factors such as overall health, lifestyle, and relationship dynamics play a significant role. With good health, proper diet, and regular exercise, many men maintain the physical capacity for sexual activity well into their later years. The video likely addresses strategies for maintaining sexual health and performance, dispelling myths and providing practical advice. When men aged 60 and above cease to have a sexually active life, a decline in physical health can occur. This isn't solely due to the absence of sex itself, but rather the interconnectedness of sexual health with overall well-being. Several factors contribute to this decline. Reduced testosterone levels. Sexual activity stimulates testosterone production. A lack of sexual activity can lead to lower testosterone levels, resulting in decreased muscle mass, bone density, and energy levels. This hormonal imbalance can contribute to a weakened physical state and increased susceptibility to illness. Decreased cardiovascular health. Sexual activity provides cardiovascular benefits similar to moderate exercise. The absence of this activity can contribute to a decline in cardiovascular health, increasing the risk of heart disease and other related conditions. A weakened cardiovascular system directly impacts overall physical strength and stamina. Lowered mood and mental well-being. Sexual activity releases endorphins, which have mood-boosting effects. A lack of sexual activity can lead to decreased endorphin levels, potentially contributing to depression, anxiety, and reduced motivation. This negative mental state can indirectly affect physical health, leading to decreased energy levels and a weakened immune system. Reduced social interaction and connection. Sexual intimacy fosters a strong emotional connection with a partner. The absence of this connection can lead to feelings of isolation and loneliness, which negatively impact mental and physical health. Reduced social interaction can also contribute to a sedentary lifestyle, further exacerbating physical decline. Increased risk of certain diseases. Studies suggest a correlation between sexual inactivity and an increased risk of certain health problems in older men. For example, a lack of sexual activity may be associated with a higher risk of prostate cancer, though more research is needed to establish a definitive causal link. The decreased testosterone levels and reduced cardiovascular health mentioned earlier also increase the risk of various age-related diseases. In summary, the decline in physical health isn't a direct consequence of the absence of sex itself, but rather a consequence of the loss of the associated benefits. These benefits extend beyond the physical act to encompass hormonal balance, cardiovascular health, mental well-being, and social connection. The lack of these benefits can significantly contribute to a weakened physical state and increased susceptibility to various health issues. Men aged 60 and above who experience a decline in sexual activity should consult with their healthcare providers to address any underlying health concerns and explore strategies to maintain overall well-being. This might include lifestyle changes, hormone therapy, and counseling to address emotional or relationship issues. Friends, choosing happiness is crucial, and maintaining good health is achievable for older men through various means. While sexual activity with a partner offers significant benefits, what if erectile dysfunction becomes a challenge? Let's explore ways to ensure a fulfilling intimate life despite this difficulty. It's important to understand that erectile dysfunction, or the inability to achieve or maintain an erection sufficient for satisfactory sexual intercourse, is a common problem affecting men of all ages, and its prevalence increases with age. While it can be frustrating and disheartening, it's crucial to remember that it's not insurmountable, and there are many options available to address it. The key is open communication and a willingness to explore solutions. Here are some approaches to maintaining intimacy and sexual satisfaction, even when facing ED. Open communication with partner. Honest and open communication with one's partner is paramount. Sharing concerns and anxieties about ED can strengthen the bond and allow for mutual understanding and support. This open dialogue forms the foundation for exploring alternative ways to achieve intimacy and sexual satisfaction. Medical consultation. Seeking professional medical advice is crucial. A doctor can assess the underlying causes of ED, which can range from physical conditions like diabetes or heart disease to psychological factors like stress or anxiety. Based on this assessment, the doctor can recommend appropriate treatment options. Medication. Several medications are available to treat ED, such as phosphodiesterase 5 inhibitors like Viagra, Cialis, or Levitra. These medications help improve blood flow to the penis, facilitating erection. However, it's crucial to consult a doctor before taking any medication, as they have potential side effects and may not be suitable for everyone. Lifestyle changes. Lifestyle modifications can significantly impact erectile function. These include regular exercise, a healthy diet, weight management, stress reduction techniques, and limiting alcohol and tobacco consumption. These changes can improve overall health and contribute to better erectile function. Alternative sexual activities. Exploring alternative ways to achieve intimacy and sexual satisfaction is crucial. This might include focusing on foreplay, oral sex, mutual masturbation, or using sex toys. These activities can maintain intimacy and sexual connection even when penile penetration is challenging. Counseling. In some cases, psychological factors contribute significantly to ED. Seeking professional counseling can help address underlying anxieties, stress, or relationship issues that may be affecting sexual function. Therapy can provide tools and strategies for managing these factors and improving overall sexual well-being. Other medical interventions. If medications and lifestyle changes are ineffective, other medical interventions may be considered. These include penile injections, vacuum erection devices, or penile implants. These options should be discussed with a doctor to determine their suitability. In summary, while erectile dysfunction can pose challenges, it doesn't have to end sexual intimacy. Open communication, medical consultation, lifestyle changes, and exploration of alternative sexual activities are key to maintaining a fulfilling sexual life. Even in the face of ED, it's a journey that requires patience, understanding, and a willingness to seek help and support.